with Miami's Community News. And our guest today is Dr. Bryan Stewart, who is the president of the medical campus of Miami-Dade College. Thank you very much for being here. Appreciate it. So I'm going to go over your resume a little bit here. All right, folks, hold on to your britches. All right. He has a bachelor's in mathematics. All right. All right. 1, 2, 3, 4, 5. A master's in mathematics and a PhD. All right. In college and university teaching with a minor in mathematics, both from the University of North Texas. Congratulations on that. So I know that means a lot more than being able to count. All right. We know as humans that people that are good at math, all right, have a certain way of thinking. All right. So it takes a critical thinker like yourself to make a campus really work. And we've been fortunate to work with a lot of the campuses and see the great leaders that the school has. So how did you wind up at Miami-Dade, and why did you choose that?
That's a great question. I'm a born and raised Texan, and you probably could tell my accent's a little different than what you're used to. A couple of reasons got me here. My dad was a university president, so I think the administration part was in my genes. But I played college basketball and majored in math and found the community college system in Texas and worked my way up the system. And my last job at Tarrant County College, where I was previously, was as the vice president. And in that role, I merged our nursing and our health science programs, as well as added 13 new programs before I left. And Miami-Dade found out about me. And so it was just sort of karma, kind of the success I'd had in Texas and the medical campus here was in need of some leadership. I think they'd had 3 presidents in 2 years. There's some leadership void. So Dr. Padron was the president at the time, and I interviewed with him, and it just was a magical fit. And I've now been here 3 years, and it just seems like yesterday.
And Dr. Padron, he's a great public servant and a terrific person, very humble. All right, and we did a special section in honor of all these years of service. You know, he wrote letters to people that thanked him in their ads. And it's like, wow. All right. So a great connection. And we want to thank him again, wherever you are, Dr. Padron, for your great service. When you mentioned that it's in your genes, and there is some of that goes on in the sense of you're around it long enough and you get sort of a feel. My father was in radio and TV and newspapers for many years, and I tried different stuff and go, well, this is natural. Interesting enough that here we are in this environment as he was in 1959 to the 60s in radio after that. But what about the young people that it's not in their genes and they're struggling to move forward? They come from, and they're not, social climbers and not economic climbers. We need something to do. How can Miami-Dade move them from coming from not an affluent area or a home? What does Miami-Dade do to get them to get in a program and to help them pass and succeed at their careers?
Well, I think that's what the Miami-Dade College has been so successful, is helping those first-time in college students. We have a significant number of our students that are first time in their family to go to college. And I think that's the avenue where we can make a really impact into families, into generations and future generations. The medical campus specifically has a lot of entry-level programs that, you realize that you want to be a nurse, but you don't know how to get there. Well, you can start as a phlebotomist or a medical assistant or any number of programs. But I think that's where Miami-Dade College is so critical to this community, is there's so many, and we're so diverse. This community is very diverse. And we have faculty who represent that diversity, so students can see themselves in their faculty. And I think that's what's so critical about the college is a student can, it doesn't matter what their background is, they can be whoever they want to be at Miami-Dade.
And you bring up a really good point. I personally know somebody that was running a blood laboratory at a local hospital. 10 years after that, he was running a hospital, a big hospital. Yeah. And that's because you're in that place, right? And when the bosses look around, who do we got out there? Okay, let's try him. That's sort of how that works, right? Yeah. So let's just go over a couple of the classes that you offer. So somebody can become a dental hygienist.
Yes, sir.
And how long is that program?
2 years, associate's degree.
All right. That is amazing. All right. You can go there, and that's at the medical campus. All right. I was just at my hygienist and periodontist and dentist the last couple of days. So that is a good job. All right. Pays well. All right. and that there's a lot of posturing and position that you have when you're in the medical arena to be able to help people. Some other things, you can become an emergency medical tech, first responder. What does first responder mean?
So the path to being a paramedic, you're first a first responder, then you become an EMT, and then you become a paramedic. And in South Florida, you have to also be a firefighter. So all ambulances and fire rescue units, you have both qualifications. So what a first responder is basically a lot of the CPR, bleeding, a lot of those basic functions. And then an EMT, which I actually went to our program. I just graduated, incidentally, this last spring. You can get a job, a really good job there. I believe if you're north of Miami-Dade County, if you're on a fire rescue unit, you have a paramedic and you have an EMT person. In Dade County, you have 3 paramedics on every fire rescue unit. So it's a really good career. We are the largest paramedic EMT program in Florida and one of the top 2 in the country.
Where I became a little bit more aware of the pride that firefighters have is at 9/11.
Yes, sir.
And when we were watching, I went, "What? Really?" And then you see the family that's there and generations of firefighters, all right? And most recently for us here was in Surfside, where these people, 200 plus people per shift out there, first responders, police, firemen, techs out there doing really God's work in going through that rubble and honoring the dead and trying to get some resolution. Big deal, all right, to do that. And there are people that I know that are firemen for their whole lives. As a matter of fact, a congressman, I think I got it right, Jimenez, was a fireman.
He was,
right?
Yes.
And then became the head of the fire department, then city Miami manager, Dade County.
Yeah.
And now he's congressman from Kendall in the area. Sorry, all over. All right. Yeah. So I might add that we had a luncheon with, and he was our speaker, and we, Columbus High School, where he went, presented him with a t-shirt with a basketball shirt, number 14 on it, in a big frame, and then I got the picture, one of the few, on his phone. He has a picture of him jumping up when he was a high school student.
Wow.
Jumping up wearing number 14, right? So when you look at it, so there's a certain pride that I think that goes through this evolution of people learning how to provide healthcare. And as I mentioned to you, I used to be a registered nurse, went to Jackson Memorial Hospital, School of Nursing a long time ago. And at the Wolfson campus, not the medical, but the Wolfson campus, there was one building when I went to school. It wasn't much bigger than this room. So Miami-Dade really has moved forward in the last 20 and 30 years and and really gotten to a nice place. Physical therapy assistant, all right, and a physician's assistant. Let's talk about the physician's assistant. You can get a 2-year or a 4-year degree.
Actually, you get a bachelor's degree with us, and you earn a master's degree. We have a partnership with St. Francis University, and we have a new partnership with Nova Southeastern. So while our students are getting their bachelor's in physician assistants with us, they're earning their master's degree, which is the credential you have to practice now, starting in 2021 in South Florida.
That is amazing. So you could go to Miami-Dade, all right, the school that is so welcoming, all right, for people of all ages, all genders, all around the world, all right, get in there. And then how long is that program?
It's 27 months.
27 months. And you can make a nice living and help a lot of people.
You can. And matter of fact, last night we just graduated 58 PAs. They had their pinning ceremony, and we had to do it in a social distance capacity, but it was so moving to see families and children come in and put the white coat and get the pin. And I believe over half of those already have jobs here in South Florida.
That's wonderful. We like to keep them
Yes,
there,
we do.
Right?
Absolutely.
And when I go to the physicians, I would say probably 20% of the time it's with the MD, all right? And the other is either a nurse practitioner or a PA.
PA, that's right.
And after a while, you realize the PA with 5 years experience, he's got it down.
That's exactly right.
The same to my nurse practitioner friends, okay? I'm sorry. So respiratory care. Is there a respiratory therapy degree. There's a 4 or 5 year degree with that.
Yeah, respiratory care is a 2-year degree. And incidentally, both of these programs have waiting. They're very popular. I'm really proud of the respiratory program. Right when COVID happened last March, we have 17 ventilators that are working, and we loan those to Jackson Hospital. So that, in April is when we really thought COVID was it was bad, but we really thought the hospitals were going to be overflown. And so we donated our ventilators to Jackson to use during the summer months for that. But that is a respiratory program. Those are the folks that were on the front lines, along with the nurses and so forth, but really popular program. And we've seen a lot of people wanting to be respiratory therapists now as a result of COVID and some of the things.
That's how I started in respiratory therapy. Back then, you didn't need any education. It was like, all right.
OJT, on the job training.
Yeah, and it was like, okay. I go, really? But in each of the programs, whether it's for nursing, they used to, years ago, it was 40 years ago, it was a 6-month program. Then it was a 1 year. Miami-Dade had a 2-year, or now essentially you have to have a 4-year. And in most cases, it's leading pretty much to a master's.
Yeah, and that's one of the things at the college we're looking at. We're adding we're planning to add a bachelor's in dental coming up next year. Dental hygiene, because a lot of the credentials are wanting, like PA did, to have a bachelor's degree. The new bachelor's we're offering this fall is in medical lab science. We offer a 2-year medical lab science degree, but the industry wanted those folks to have a bachelor's degree. And we have a number of bachelor's degrees in our pocket. That's the beauty of the state of Florida, is they allow community colleges in certain areas to offer bachelor's degrees. And in South Florida, as you know, has so many great hospital systems and so many jobs, and us offering additional coursework really allows the college to help hospitals, with their workforce and so forth.
And as you mentioned, a lot of times this is the first college experience in their family.
Right.
So, but you must feel particularly proud of your staff and of the students when first in the family graduate from college.
Yeah, it's a really emotional thing when we have the pinning ceremony for PA last night. We do a nursing pinning twice a year, and it's just a moving thing to see the pictures, and it's really emotional. I struggle sometimes getting through the night thinking about the lives we're changing.
So when I keep going back to what you said, it's in the genes. So a student now who's the first in their family to graduate from college, they are setting the stage to get it into the family. I'm going to do what Dad did. I'm going to do what Mom did. They got a 4-year degree, whatever it happens to be in. In my family, my father was really bright, went to the University of Chicago when he was a kid, never graduated. Well, I was the first one, all right, to graduate. And I still, it's like, oh, well, both my kids both have masters, all right? And one went to WashU, the other one FIU. And so I look at it. So we did good, yeah. All right? And that's how it gets into your lineage, so that future generations can say it can be done, and I know somebody.
Right.
Lots of times people with advanced degrees don't understand the impact that they can have on other people's lives. One of the things that we used to do, I knew a lot of young people that had their 4-year degree in some health-related thing at FIU. I would invite them to the house, and I would make sure I had people in the health arena that had either PhDs or the masters. I said, I want to introduce you to somebody. And just recently, 2 of them, one became a physical therapist. That's not a PhD, but it's a doctorate in physical therapy.
Absolutely.
And the other one became a nurse practitioner. And I know that we were part of that.
Yeah.
And one of them was very involved in politics in this industry. I know that was from here, right? Because you can see, when you look into their eyes, and you can see that, right? Yeah. That you can make a difference. So I've got some notes here. All right, let me look at these. Okay, all right. And why should a student who's wondering where to go? They're here. Their parents are working hard. Maybe it's just one family, one parent that's there. Why should they pick Miami-Dade in their hometown to go versus another school?
That's a really great question. A couple of really good things. The first thing I want to say is cost. One of the things that I lose sleep over is the competition out there that gets students in debt for college. Our nursing program is the 4th most affordable program in the country. And I think that's the first thing that students can get taken advantage of. Those students that are first time in college, they don't have a parent who went to college, so they can sometimes be taken advantage of and get in debt. So that's the first thing. The second thing is our college does a great job with wraparound services, I call it. When you come to Miami-Dade, you have an advisor, you have a lab, you have all sorts of support services to help you succeed. Not that the universities and other places don't, but the environment, I think, with the support services and all that helps support our students better. And then I think that the other thing is the history of the college. You mentioned Dr. Padron, our current college president, Madam Pumariega, was a former president of the Wilson campus and has a great history here in Miami. And I think that the history of the college really helps people get jobs. Oh, you went to Miami-Dade? It's rare I go anywhere that I don't find a graduate. When I first came and met my faculty, 80% of my faculty have a degree from Miami-Dade College. That's unheard of. I've never heard of a college doing that. And so I think the fabric of the community that this college touches helps our students give back and like we talked earlier, improve their families.
So a few years ago, maybe longer than a few, Miami-Dade was running a campaign. They would have a little bit post ads about this big, I am Miami-Dade. And when I would see the people that are there, I went, oh, look at that one, look at that one. And it does cause that connection, and it's a good feel from that. I went to Miami-Dade, a long.
Thank you for that.
Well, my pleasure to do it. I still remember my student number. I don't know why I remember it. But some of my great experiences at Miami-Dade, there are two really big ones, and I want to share with you. And it's a tribute to the not just the teachers, but the system in there. Now, that was a long time ago. I was failing an English class. And the teacher comes over. She said, what's the problem? I said, every time I start, I get lost. She says, come with me to writing. She said, we have a special class. I go, okay. It was in her office, which was maybe a 6x8, maybe, with two desks in it. Sit down. I go, where's the class? This is the class.
One-on-one.
One-on-one.
Yeah.
Big difference. Somebody is paying attention to me. I'm not alone.
Yeah.
She says, well, what goes on? I said, I start writing, typewriters, all right? And I get frustrated. I pull it out. And she says, next time that happens, just stop, pause, and start again. It's 50 plus years ago, plus. And I still do that, except for I don't have to take the paper out.
Yeah.
And then also, anatomy and physiology teachers, all right? I'm still friends with the widow of my professor.
Oh, cool.
19, whatever it was, a long time ago. The friendship that I had with him really was significant. Somebody else had cared enough to say, come on, let's go do this.
Yeah.
Cecil Taylor, Mary Taylor's wife, if you're watching, hello. Actually, she called me about a month ago. I picked up the phone and I called her kids. How are you? I haven't spoken to them in generations, but the fondness is still there that Miami-Dade was able, to do that. So as far as getting a degree in the health sciences, all right, Miami-Dade, how does that compare to another similar type of school across the country?
So a lot of the programs we offer are similar across the country. What's unique is the volume of programs I think we have. We have 25 health science programs. And all of the degrees are very similar in terms of you have a didactic or a lecture part, you have a lab part, and then you have the clinical rotation. And that's really what I say is the cherry on the top for the degree. They get that hands-on experience. They get the ability to be in the different hospitals. And a lot of times the hospitals end up hiring them because they're basically on an interview for their clinical rotation.
When do they start going, nursing student, when do they start going to the hospital?
The first part of the program is the skills and the foundation. And it's after that first 2 months, 3 months, then we start doing clinical rotations. And they're pretty much in clinical rotations all the way through the 2 years.
As I mentioned, I graduated from the Jackson Memorial Hospital School of Nursing, where the academics were at Miami-Dade. When we worked on the floor from the get-go, the confidence building that is there, and when you finish, you've had these, that was a 3-year program, if I remember right? And I was so proud to be able to work on the floor, and I didn't have to wait to the end, all right? And you knew with your counterparts that didn't do clinical rotations, you knew the difference.
Yeah.
And so did everybody.
Yeah.
Right. And so it was a great experience. So here you have let's talk a 20-year-old student working on the floor, Miami-Dade student in a 4-year program. All right. Do you happen to remember the age, more or less, the average age of either them going in or finishing?
So the college is a little younger than us. As a rule, it's about 24 to 26. Our student average age at the medical campus is closer to 29. So we do have a little more mature, older student. But to me, that's what makes it so fun being on campus, because you walk our campus, you see the different uniforms and all our programs, but you see students that have a dedication. They have a focus.
So those students, they went back. It wasn't like I'm on the train and I'm going to go to high school and I'm just going to like finish wherever I happen to fall off. Right. They had to make conscious decisions to go do that.
And for the most part, they go to one of our other campuses to get their basics out of the way. Now, many of our programs you can come straight to us in, but most of them require science, anatomy, physiology, microbiology. So they'll go to the Wilson campus or the North or the Kendall. And that's the beauty of my job is I get to recruit from all of our campuses. And so, but you're right, they have to have an intentional desire to come see us. And so they have to get those basics out of the way, those prereqs, and then come get in their particular programs.
So I didn't see on here the Mortuary Science. Is it on here somewhere?
So Mortuary Science is on our North Campus.
Okay.
Very popular program. And I think it also has a really good enrollment, but it's on our North Campus.
So it looks like, as I look at these, people with their degree here, whether it's a 2-year degree or a 4 or 5, when they finish, they got a job.
They have a job. Yes, right? Sir.
And let's talk about how students are getting educated today as compared to 10 years ago. How is that working?
Well, really, even 2 years ago before COVID. COVID has really changed how we teach. In our nursing program, we were very didactic in bringing students on campus. Now we've added a lot of blended teaching and online teaching. There's still no replacement for the hands-on. But 10 years ago, I think you came to class, you came at a particular time. Now we're more flexible because our students have families and they have a lot of responsibilities. One of the stats that's very eye-opening is 42% of our students are living below the poverty level. So as a college, we've got to match and really think about when they can come to college. It's not when the professor needs to teach, it's when can the student, because they may have another job.
So that changed in the last 25 years.
Very much so, yes, sir.
This is the class, you better go to it.
Yeah,
right?
Yeah.
And we look at it that we know when students go to class, and if they live on campus, Miami-Dade doesn't offer that, but the other school, there's a certain camaraderie that you have. So how does students switch from going to class and enjoying and seeing that guy or gal that they want to, and maybe go to lunch with it and having an afternoon of it, all right? And the good feeling you have when you have your books, if you have books nowadays, all right? But walking on campus, say, this is really good, and running into the people. So how are the students dealing with that part that is not there?
Yeah, that's a really interesting question. One of the benefits of our medical programs is all of our programs are cohorted, meaning that the students are admitted. Like we admit several hundred nursing students 3 times a year. We admit PA students once a year. So that we'll admit 55 students this fall, and they'll be a cohort. And so we saw them graduate last night. So some of that camaraderie and some of that old school mentality we're used to still occurs. But many of the basic courses can be taken online or blended. And so there's a lot more flexibility. And as Miami-Dade College, we have to have that ability to be able to adapt. If we don't, then a student's going to run off to some other school that's going to serve and meet their needs.
And obviously aware of this, talk show hosts have been doing that split audience, for 50 years.
Yeah.
They have the audience that's in the studio, and then the rest of it is out there.
Yeah.
There's nothing like being there and applauding when your person's there. But certainly there is a need for people to be able to go to class, all right, online, and then also in class. Both my kids, they were very involved in online, and it seemed to be fine, and they're both well adjusted. It's their parents that are not anymore. So what is going to cause somebody to say, I'm going to go to Miami-Dade online versus some other school online, and again, without that on-campus experience?
Well, I think there's a lot of things that go into decisions like that. I think those that live here in Dade County, as we talked earlier, the history of Miami-Dade College hopefully will attract them. But that's one of the reasons we have to be more competitive as a college, because there's the University of Phoenix and other schools that are in our service area, so to speak, and we have to show students why we're better, why we're different. And I think there's a lot of, there's certain courses that lend themselves to online, but imagine taking a calculus class or,
I can't imagine that.
Well,
you can. But Tommy might be able to.
And so I think what we have to do is, as a college, be able to show a student how they can get a holistic education, how they can, they may be good at math and can do a course online where you may not and need to have it face to face, but they may do classes in others that we couldn't do well. So I think that's why people choose Miami-Dade College, is because of we're constantly reinventing ourselves. And
so when you think of the young student, 22 to 25 years old, when those ads were running before and they'd say, I'm from Miami-Dade, they may not know, all right, that person, but they may recognize the name, something that they like, or whatever company they happen to be with. And when we look at things, all right, we say, who's going to the party? All right, who's going to be there?
Yeah.
And then we make decisions who's going to be there. We do special luncheons and breakfast. And when we do them, people say, who's the speaker?
Yeah.
Right? And then we try to find the right speaker to attract an audience. And we know different speakers bring different guests to do that. So I was wondering, on the campus, is there a dental clinic on the campus?
Yes, sir. Actually, we have a dental and a vision clinic, and for $30, you can have your teeth cleaned in our program. $30.
And the hygienists are there.
There are students. We have our own dentist that then will evaluate your teeth. I've personally had my teeth cleaned by our students. I've had my vision checked by our students, and even if you can't afford that $30, we'll find a way to take care of that for you. But we really are proud of our clinics. We're looking at a physical therapy assistant clinic one day, and we had a medical clinic that we're in a renovation process. So to me, that's a really important service that we can do to the citizens.
So the vision, because you have an optometry classes.
We have a program, a 2-year program.
And that degree would be in
optometry, opticianry.
And so that could be, you could go to work at an optometrist or maybe an ophthalmologist's office.
Right? And you test the eyes, you do the glasses, all those things, and it's a very good degree, really good degree.
And so we know what happens over the age of 50. You need glasses, buddy, or surgery. Either one is okay.
Mine are right here.
So, as you look down the road, next couple of years and 5 years, tell us about some things you'd like to bring to the medical campus.
So we have a brand new surgical technology program starting this fall. There's a couple of certificate programs, which are 1-year certificates. The surgical tech group is requiring a 2-year degree. So we're really excited about that degree. We have a central sterile processing, which is a stackable credential to it. It's a 1-year degree. They're the people that clean the instruments. That'll start a year from now. We have a program in hematology that we're getting ready to start, one in ortho with casts and that kind of thing. I have a list of about 15 different new programs that were
10 years ago. These programs weren't anywhere.
No.
How would the employers get people to do that?
Well, it's funny you say that. There's a statistic out there that in the year 2030, 50% of the jobs don't exist in the medical field. So to answer your question, Baptist Hospital couldn't find surgical technicians. So they were taking staffs within their hospital and training them to be surgical technicians. And our students pass licensure tests. And so we're really going to help the hospital surgery community because we'll have registered surgical techs in there. But they have to take that. That's what's great about being in the medical industry, especially in nursing. You may get your nursing degree and you may start in the adult med surg area, but who knows, you may end up in oncology. There's so many ways to go, and hospitals have to be able to train people, and that's what Miami-Dade College comes into play. We can do that training for them. And so what I want to do in the next 3 to 5 years is for Jackson or Baptist or Mount Sinai or Leon Medical to pick up the phone and say, hey, Bryan, we need this certification, and we'll do it.
And the reason they want that certification, whatever it happens to be, is why?
Because the industry's changing. Think about surgery. Think about the doctor's office you go to now versus 20 years ago or whatever. And we have to turn out graduates who can use the technology and it can update, on the skills and the knowledge base that's out there. That's one of the things I think about my kids. When we were kids, you think about the knowledge we had to learn versus what they have to learn now, and what knowledge has occurred between when we were in school and now. And it's a technology, of course, has helped that with the phones and all, but we have to stay on the cusp of that with our hospitals. And all of our programs have what we call advisory committees that meet twice a year and have industry people to make sure that we're keeping our curriculum up to date and where it needs to be.
I'll tell you something interesting. In the 1980s, we started, before they started importing birds from exotic animals, including birds. And so we would get babies. There was no baby food for baby birds. We would have to get monkey chow. They were monkeys, all right, and we would chop it up and we'd add stuff to it. Well, before too long, somebody invented baby food for birds, and because the needs started changing. And when you look at how that happens, and sometimes it's just immediate, and somebody says, we could go do that, let's go do that. So the industry changes a lot, obviously.
It does.
So here we are, almost August 2021, all right? Schools is going to be back in session.
About 3 weeks, fall starts. Yes, sir.
What does it look like on campus as far as masks, no masks? How does that?
We have been social distancing. We're in what's called phase 2 of the college's plan. We wear masks on campus, and our students stay 6 feet apart. We've had to convert large lecture halls that would hold 100 students into ones that hold 50 now. So we've been really intentional about keeping our students safe. If I had some wood to knock on, we've not had really a COVID issue on campus in months. A year ago, by the way, the medical campus opened back up a year ago, August. We've had significant students on campus over the last year. And so we've been very conscientious of trying to keep COVID outbreaks down. And what we would have is students who would come to campus and they'd be around friends and they would bring it to campus and we'd have to quarantine. But we've been very fortunate in the last several months not to have anything like that. But our campus, you see students around, you see faculty. I'm excited for the fall to get here. Our nursing students, by the governor of Florida, have been allowed to be remote since last March. And that order ended in June. And so those students will be back on campus. So they're going to see a campus with masks on, but they're still able to gather. They're able to have lunch. They're able to, study and have fellowship and that kind of thing.
So we know that social emotional problems are at a peak right now because a lot of reasons, COVID certainly, and down for here, the tragedy at Surfside. And we know drug overdoses is way up.
Mental health issues.
Yes.
Yeah.
So if a student in Miami-Dade is having, they just are not feeling good, what should they do?
Well, we have mental health counselors on our campus. We have professionals that come in and of course, obviously their faculty sometimes can help because they're their teacher, but we do have ways to help students who need someone to talk to.
And part of the thing that I think a lot of people are afraid of, they can talk about their hands got hurt, or their foot got hurt, or they had a heart or whatever, and they have no problem telling people. But if you're not feeling good, you got a emotional problem. People, there's still a stigma attached.
There is, and I think that we're starting to address it. I know there was some bills in the legislature this year dealing with mental health, and some of the things that have happened in the Olympics, even currently. I think it's going to put that more on the front page. And certainly, Surfside was just such a tragic incident. We need to support the community because that impacts a lot of things. And hurricanes happen here, and who knows what the next thing is. And so I think mental health needs to be, and it is on the forefront that we talk about in our administrative circles.
Years ago, Jackson Memorial had a mental health budget, and they would send to, if you were employed people, you paid X amount of dollars per year per employee, and they would come down and it would give a certain number of visits per year. So we would always schedule ours from September to March. So we had 2 years worth of stuff. And it was so popular. Things that people would come to me and talk about. After a while, I said, no. Talk to a third party. And it was so helpful for people. So again, so the teachers can help. And if you can't, and there's help on the campus. If you don't want to do campus because you want a little bit more anonymity, you can dial 211. They can help you. There's National Alliance for Mental Illness. There's Children's Bereavement Center, and all those places. Don't worry about the money. You just got to tell them what the problem is. They can help directly.
Right.
Dr. Stewart, thank you so much.
It's been a pleasure to visit with you.
And continued success to you. Yeah. And you still play basketball?
I do, regularly.
Okay.
Full forward.
All right. Good for you. And Tommy has a show called Mainline Marlins every day where podcasts are seen, heard everywhere. Give us 10 seconds about the Marlins, Tommy.
Tomorrow's the trade deadline, so we're going to see what happens. But we've already lost a couple of guys and see if we're just going to go back to the rebuild mode, or we're going to try to give it one last push to make it to the playoffs.
And remember, it's the Miami Marlins and Miami-Dade College. Folks, thank you very much for your time. We appreciate it, and enjoy your day. Dr. Stewart,